Everybody to our first webinar of this academic year, but actually it's the 15th we've run overall. So we're going to hear about two emerging health issues this time, starting with dating and relationship violence, and then we're going to follow that up with gambling. And I think they both really clearly show the value of our the School Health Research Network data and what is possible because of the numbers of the survey. So I just want to just remind you that previous webinars are available on our network, on our website, and then you can follow those at leisure. So there's all sorts of different topics: health of looked after children, sex and relationships education, self-harm. And just I want to welcome everyone who's joined us. I realise that you're on computers, laptops, and some of you on phones. So if you are on a phone and you can't actually see the PowerPoint presentation and you'd like to, Danielle is standing by or sitting by her desk. So if you email the Shern general number, shern@cardiff.ac.uk, she can forward the slides for you. So joining us today are sort of network school staff, healthy school practitioners, National Quality Award verifiers. And just in case there are some of you that haven't joined a webinar before, if I could just point out a couple of things. So on the left-hand side of your screen, you will see a button that says Attendee Chat. And if you can type any thoughts or queries as they occur to you, press enter, and then I can ask as the time seems appropriate during the presentation. You'll see that Matt has put up there, if anyone's having any technical issues, that's the place as well to let him know that. So he's working to make sure it all goes smoothly. So we're really privileged to have with me for the start of this this webinar Sara Long, and she's not long back from her maternity leave, so it's really great that you've agreed to come and do this part of the webinar. And we're looking at dating and relationship violence, victimisation and perpetration among young people in Wales. So I'm going to hand over to Sara. I think Matt's dealing with a question where perhaps it's not so clear, so we'll continue until Matt tells us maybe that's that we can't continue anymore. So Sara, if I can welcome you, and then we can move forward into your slides. So there we are.
Perfect. Thank you very much, Joan. Like Joan said, I'm going to be giving a talk on dating and relationship violence among young people in Wales. It's going to be a very brief talk, but it's going to be an overview of a paper that we've recently published. Okay, so like domestic violence, dating and relationship violence includes emotional, physical and sexual abuse. In the UK, the term domestic violence refers only to those aged 16 and over, and so it's often assumed that domestic violence doesn't occur among those under age 16. In addition, very little is known about prevalence and experiences of dating and relationship violence among young people in Wales, and very little is known about the relationship between dating and relationship violence and socio-demographic characteristics such as ethnicity, deprivation, age and gender. So although research in the area is limited, we do know that adolescent DRV has been linked to poor mental health, substance use, teenage pregnancy and eating disorders, among other social and public health problems. And I just want to note that I will actually be using the terms dating and relationship violence or DRV, domestic violence or DV and abuse interchangeably throughout the talk. Okay, so I'm going to talk briefly about the methods for the study. So we analysed data from all students aged 11 to 16 who took part in the 2017 Student Health and Wellbeing Survey. We asked almost 75,000 students who had ever experienced, who had ever dated or been in a relationship, whether they had experienced or perpetrated emotional and physical DRV. And we examined prevalence rates and patterning of DRV, social patterning. So emotional DRV we defined as hurtful comments, while we defined physical DRV as a range of behaviours, physical behaviours, which kind of went from being pushed or shoved or slapped to being punched, kicked and beaten up. So we analysed victimisation and perpetration separately, but we also analysed them together to see whether there was overlap. And we analysed social patterning of DRV using characteristics such as that I previously mentioned, ethnicity, deprivation, age, gender, and family structure. And what I mean by family structure is whether the pupils came from a dual parent household, a sole parent household, or came from step families, or whether they perhaps were in residential or foster care. Okay, so moving on to the findings. When we looked at emotional DRV, what we found was that more girls than boys experienced emotional abuse. We found that just under 1 in 5 girls perpetrated emotional abuse, whereas 1 in 6 boys perpetrated emotional abuse. So more girls than boys perpetrated this type of abuse. And we found that 13% of boys and 17% of girls experienced and perpetrated emotional abuse. Moving on to physical DRV, more conversely to emotional DRV, more boys than girls experience physical violence. So the figures were 17% of boys and 12% of girls. Slightly more boys than girls perpetrated physical dating violence. And approximately 6% of boys and girls had both experienced and perpetrated physical abuse, or DRV. Okay, so moving on to the social patterning of DRV. There was no patterning by family affluence, and essentially what that means is that students with different levels of family income were just as likely to report DRV. We found that students from single or step-parent homes or those in care were slightly more likely to report DRV. And we found that as students got older, the likelihood of experiencing and perpetrating DRV, so the likelihood of all types of DRV, increased at a faster rate for girls than it did for boys. So what that means is that as girls got older, they became more vulnerable to DRV than did boys. So thinking about where this study fits in the bigger picture, it was the first nationally representative study in the UK to look at DRV among young people aged 11 to 16, and to also look at emotional and physical DRV separately. Another point to make is that all of our data was collected at one time point. Another name for this type of data is cross-sectional data. And essentially what this means is that we can't determine when and which types of dating and relationship violence came first. And the other point I want to make is that we don't know whether the students that perpetrated DRV did so in self-defense. And finally, the prevalence of dating and relationship violence was lower than for other studies, some other studies in the area. And we think this might be because of the relatively young age of our sample. So essentially, there were few students that reported dating experiences, and of those that did, they were relatively early on in their dating career, so they haven't had as much chance to accumulate or potentially be exposed to these types of experiences. Another reason why the prevalence of DRV was lower in this study may be that this was a school survey, and also this stigma associated with being a victim or a perpetrator, and this might have led to underreporting. Okay, so to summarise, more girls than boys experienced emotional DRV, but more boys than girls reported physical victimisation. Compared to students living with both parents, adolescents from single or step-parent homes and those in care were more likely to report any type of DRV. In terms of implications for schools, okay, so this is clearly a common public health issue. The age-related increase in all types of dating and relationship violence in both girls and boys highlights the need for early and universal interventions. And I think this next point, the final point, is really important. Mutual conflict within relationships, and what that means is where young people are both perpetrators and victims of violence, suggests a need for interventions that focus on the development of healthy relationships.
Right, well, thank you very much. I think that last slide, as an ex-teacher and as someone who works with schools, I think is really important because, it's a sort of new emerging sort of health topic, and one that schools might feel a bit nervous about looking at. But I think the way you're saying here, that if you link it to sort of healthy relationships, a sort of positive slant on healthy relationships within a whole school setting, really, I think that it feels more comfortable maybe for schools dealing with some of this. I'm looking, I don't think we've got any questions, but we can certainly put, if you want to email in any questions, if Sara would be able to respond to those. But I think, it's just that comment really about where it fits, so not to be scared about it, because if it fits with the sort of bullying approaches and other healthy relationships approaches in schools, then that's perhaps the most important way of tackling it. So we have got a research brief that we will be sending out shortly with the one on the gambling, so that you can read an easy read version of the actual report. But obviously it links to the whole report. So if that is something that you're very interested in, then you can actually read the full report. So thank you ever so much. Thanks for your time. And now we'll seamlessly swap over so that we can have our second presenter, who you will no doubt recognise. Graham is a great supporter of sharing webinars, or he's very he does a lot of research. It's one way or the other, Graham, I'm not sure. So maybe both. Yeah, that's true. So so this is a very new sort of health topic, and I think if we move forward to your first slide, you can explain sort of a bit about that. So thank you.
Okay. So I'm going to be talking about some analysis that was led by one of our colleagues who's now kind of left us and moved to Exeter, looking at young people's gambling in Wales. So the prevalence of gambling, the types of young people who are engaging in gambling, the types of gambling that they're engaging in. And in terms of this is something that hasn't really been studied that much before within things like the health behaviour of school-aged children survey in the past. We know that in adulthood, kind of problem gambling is associated with quite a wide range of potential psychological, social and financial costs, not just to the individual who's involved in gambling, but also to people around them. I think we often assume, probably correctly, that problem gambling in childhood and adolescence is really quite rare. But like with lots of other risk behaviours, so smoking, drinking, kind of early experimentation is often kind of a signal of kind of elevated risk of the likelihood of later problems emerging. So we're kind of interested in understanding the prevalence of young people's experimentation with gambling, how that was distributed across the population, and some of its kind of causes, in order to kind of understand kind of how normalized gambling is becoming within sort of wider society. So if we see lots of young people experimenting with something, it doesn't necessarily signal that there's a problem, but it kind of suggests that it's something that's becoming quite normal and that it's appealing to young people and they're able to kind of access it quite widely. So while we were, shortly after we conducted the last survey, there was a report by the Gambling Commission which involved a kind of smaller survey across Great Britain, and they estimated that about 12% of 11 to 16-year-olds had engaged in some form of gambling using their own money in the past 7 days, and that 39% had engaged in some form of gambling in the past 12 months. Now, our kind of much larger Wales-specific study actually found very similar findings to that. Our estimates were that about 11% had engaged in some form of gambling in the past week, and about 40% in the past 12 months. In terms of kind of the kinds of gambling that young people engage in, there was a lot of media interest when this paper came out, and we spoke to a lot of kind of papers and news stations about this. And I think a lot of outlets were quite surprised by how little kind of things like the internet featured in here. There was an assumption that young people would be kind of gambling in their rooms on the internet, but actually the most common forms of gambling were things like fruit machines. And the next most common was things like card games with friends, or kind of placing private bets around kind of sports and other things with friends, followed by kind of lottery and scratch cards. So commonly, just not necessarily something that kids are just doing in their bedrooms on their own, but often something with a quite strong sort of social dimension, kind of an interaction between peers. Now, those colours haven't come out quite as clearly as they were on my screen earlier, but I'll just kind of talk through these figures in terms of kind of who gambles. So these are the average kind of counts of different types of gambling engaged with in the last 7 days, just to give us some indication of demographic variation. You see, gambling is more than twice as common amongst boys than it is amongst girls. If you look at the bars reading year 7 through to year 11, you see a kind of stepped kind of increase from one year to the next in the kind of prevalence of gambling. By ethnicity, other white ethnicities and black and minority ethnic groups are far more likely to be engaging in gambling than those from white British backgrounds. There doesn't seem to be a huge amount of patterning by affluence levels, and actually by contrast to a lot of kind of risk behaviours, children from more affluent backgrounds are engaging in more gambling, and I guess there are obvious explanations for that in terms of having more financial resource available to be able to spend on gambling. And the final kind of thing we looked at, and I've just kind of picked out the figures from the extremes here, is kind of school connectedness. So how gambling varied according to how connected young people felt to their school, the extent to which they agreed with a statement around that I feel like I belong at this school. And you can see there that for children who strongly disagree with that statement, actually their gambling counts are about 3 or 4 times higher than children who strongly kind of agree that they do belong to their school. So gambling's higher amongst boys, older pupils, minority ethnic groups, more affluent young people, and kind of children who feel more sort of disconnected from their school. So, I mean, what some of this patterning is kind of suggesting is actually there are social dimensions of gambling, and its patterning does kind of resonate with a lot of kind of things that traditionally in public health we've seen as kind of emerging adolescent risk behaviours. So, historically, kind of things like smoking and drug use are kind of things that we know that young people engage in as kind of alternative markers of identity and status and social bonding, and often the young people who are at most risk of using those things as alternative forms of bonding tend to be those young people who feel kind of most poorly connected to school and to mainstream society. And kind of likewise, gambling here, we're kind of seeing potentially emerging as a kind of an alternative form of social bonding and identity construction for young people who feel like they don't belong at school, young people who are in the minority because they belong to minority ethnic groups. So a lot of the patterning we're seeing here is quite similar to what we've seen historically for a lot of kind of more sort of established risk behaviours. In terms of how gambling makes young people feel, just asking those young people who said they've engaged in some form of gambling in the last 12 months, how often they've kind of felt bad about their gambling. The vast majority say never. And only about 1 in 6 young people who've engaged in some form of gambling kind of say that sometimes they felt bad about their experience over the last 12 months. And actually kind of suggests that for most young people, then this kind of engaging in a little bit of gambling, it's not something that's causing them any immediate kind of harm. It's not something that they're kind of overly worried about. But actually, this tendency to be slightly worried about kind of gambling behaviours does seem to increase with age. So young people, kind of older young people are worrying about their gambling. So as they kind of progress throughout adolescence, the gambling is perhaps becoming more of an issue. children again from minority ethnic groups, and children who feel they don't belong in school. Those young people are also more likely to gamble and more likely to worry about their gambling, suggesting that kind of prevalence is higher in those groups, and also that it's perhaps more likely to be problematic gambling in those groups than some of the other groups. So kind of just some kind of tentative indication that actually gambling is starting to, in some cases, become slightly problematic as young people are moving through adolescence. It's getting severe enough to cause them some worries. So just a kind of summary of that. I mean, experimentation with gambling does appear to be quite widespread amongst young people in Wales, and we don't have a huge amount of historical context here because we haven't really measured this much in the past. So we don't know whether this has been the case for years, and we're only now starting to measure it, or whether this has been quite a recent thing. But and I think for most young people, we know that adolescents engage in risk behaviours. Adolescents take risks. That's part of growing up. And probably for many young people, that it does just represent an unproblematic kind of engagement in kind of normal risk-taking behaviour. But for some people, that might sort of signal greater likelihood of problems later in life. And some of the patterning we're seeing in kind of prevalence, and the prevalence of kind of worrying about gambling, does kind of show quite a lot of similarity to more established kind of traditional public health issues like smoking, drinking, drug use. So I think it's an issue that's only really starting to receive attention now. We're starting to kind of get our heads around, and I think like going forward, kind of work with schools, policymakers, and young people themselves is vital in kind of understanding kind of is gambling emerging as a public health issue, and how we might kind of limit young people's exposure to gambling. And I know that there's work going on with some of our colleagues in Scotland at the moment, kind of using kind of peer group based interventions similar to things like the assist intervention to try and sort of kind of disseminate messages around gambling through kind of school systems. So we'll be kind of keeping an eye on what's coming out of those teams elsewhere in the UK as well.
Yes, we'll certainly sort of try and feed back any of those, if it's some helpful things to support schools. I guess that would be good, because I think again it's a bit the same point with Sara's, is that I mean, you were saying all about the school connectedness seems to be absolutely vital here. So that's a sort of generic sort of thing that schools can work on, and it will. I mean, do you agree? It can support lots of the different health areas within a school, because there seems to be that link, doesn't there, with a few
with lots of things.
topics.
So I think that there's a huge amount of evidence coming out recently around kind of intervention trials which do focus on changing the environment to make young people feel better connected to schools, and those have impacts across a whole host of outcomes, from kind of mental health, substance use, truancy. And I don't think they've ever been evaluated in terms of their impacts on things like dating violence and gambling. But you can imagine kind of a lot of these risks do share quite common pathways, which kind of does mean they are likely to be influenced by the same kinds of interventions.
Yeah, because I do think, there's always that worry, I think, in schools, oh my gosh, something else we've got to deal with. So I think if we can support and help schools to realise that, there are some, as you say, environmental issues, so the whole school things that they can do that could impact, very much on all of these different things, instead of having to fit it all into, even with the new curriculum, that will feel, could end up feeling very crowded. But I think that's a sort of win-win, isn't it, that message? So hopefully that's what we can take forward and help. But thank you so much. I really appreciate hearing about two things that are new to me as well, and that's been a really useful webinar. So thank you very much, Graham. So I think unless you wanted to say anything else, I think I'll just do a little bit of network news, and thank you.
I think people have heard enough of my voice.
Well, they've certainly heard enough of mine, but there we are. So just a little bit of network news, just to go to explain again that we will be sending research briefs out to everybody who joined this webinar, and they will be available on our website, and that will be able to sort of support the information you've heard on this webinar. Just an important thing that's happening at the moment is the Student Health and Wellbeing Survey, and it's well underway. So it was opened in September, and we've got so far up to about 60,000 young people in Wales who've already taken part. So I just want to thank any of you who are in schools who've completed this survey, and I think this webinar, as all the webinars, just show how invaluable that data is outside the school, you know, as well as in schools. So just a little plug that there's about 4 weeks left, and the survey closes on Thursday the 19th of December, and any queries, just get straight back to us and we'll try and help you sort those out. Just a couple of dates. So the next 2 webinars, there's one in February and one in March. So you can get those in your diaries. We've sent them out already in our newsletter, but that's just another reminder. And then we've got some for the schools, the dates for the diaries for the summer events. So we know how busy your diaries get. So we've got the dates there, and the people evaluated the venues very well. So we're going to go and stay with those 3. But obviously we will be letting you know about Easter, how you can register to attend those. And then just one other little plug is that in the same survey round, so it's every 2 years that you do the student survey, we're going to be asking schools in the spring just to complete one school environment questionnaire, and that's for you to explain what policies and practices around health and wellbeing are, you know, in your schools. And we've heard today how valuable, you know, that can be for us. So it'll be late January, early February, and it open for 6 weeks, and for the first time it'll be electronic. So hopefully that will make it more easy for you to complete, and it will be either the health and wellbeing lead that does that or a team of interested staff. I don't quite know what I think. I've made a bit of a spelling. The data with the student survey data is invaluable, right? Yeah. So just that by filling that out, it is a useful thing for you, but it's it's invaluable for the whole Wales sort of health research. So I think that's it from this webinar. Thank you ever so much for joining us, and we'll see you again then in February. Thank you.